When wearing tight-fitting RPE, it is important to make sure the mask fits correctly and gives an adequate seal to the face. Face fit testing has been a requirement in COSH since 2002. The guidance that should be followed is HSE INDG 479. Other useful guidance is the Respiratory Protective Equipment at Work HSG 53 and the Workplace Exposure Limits EH 40. All tight-fitting RPE, anything from a disposable FFP, half masks, full face masks and even BA should be fit tested. Loose-fitting RPE, which could be a hood, a blouse-on or an air-fed visor system that doesn't rely on the seal on the face, doesn't require a fit test. Face fit testing should be carried out as part of the selection process. Fit testing is mask specific. If you change the make, model, size, a new fit test is required. Other reasons for a repeat fit test might be company policy, significant weight gain or loss, substantial dental treatment, or facial changes such as a broken nose, jaw, mole or scar. The two main types of face fit testing are quantitative, ambient particle counting, known as APC, and qualitative, known as the taste test. This is the qualitative method. The kit consists of a hood with a fixed collar, two nebulizers marked A and B, sensitivity solution, test solution. This could also come in a small bottle, full instructions, report cards and a timer. Before carrying out face fit testing, you need to ensure you are properly prepared. You need a well ventilated room, still drinking water, paper towels, a mirror, timer and the masks you are going to fit test. The employee must be clean shaven in the area of the seal. They shouldn't eat, drink, smoke or vape for at least 30 minutes prior to the test. If they have prescription glasses, safety spectacles or other PPE that could interfere with the seal, they should also wear those during the test. If using an ampule, make sure the cardboard sleeve is in place and apply pressure to release the solution. You should hear a cracking sound. Squeeze the solution into the A nebulizer. This ampule is now empty and can be thrown away. Before replacing the top, make sure that the atomizer is correctly fitted and that the O-ring is in place. Then screw the top back on. This is now ready for use. The same should be done for the test solution marked B. The purpose of the sensitivity test is to establish whether the wearer can detect the taste. The hood is designed to go over the head. There's a hole in the middle of the visor for inserting the nebulizer and one in the collar for the wearer to retain its position when in use. When carrying out the sensitivity test, it is important to make sure you use the A solution, removing both plugs. Check that the nebulizer is working and then ask the wearer to open their mouth with a slightly protruding tongue, and then I will insert the nebulizer and squeeze up to 10 squeezes and you tell me when you can taste it. Thank you. When the wearer has detected the taste, remove the hood, make sure they have a full glass of water and they wipe their face with a tissue or a paper towel. There are 3 levels of sensitivity which will be applied during the test exercises. They are determined by the number of squeezes of the nebulizer in the sensitivity test. If the test subject detects the taste between 1 and 10 squeezes, the level is established at 10. If the test subject detects the taste between 11 and 20, the level is established at 20. And if it tasted between 21 and 30, the level is established at 30. Prior to the fit test, it is always important that you give clear instruction and a demonstration of how the mask should be fitted. A mirror should be used to help, and always follow the manufacturer's instructions. Okay, take the mask, take the bottom strap and pull that over your head onto your neck. And then with the top strap, put that into the crown of your head and untangle by running your fingers through the strap. Adjust if that's it, good, top and bottom, and then with 2 fingers adjust the nose band into position. When the mask has been fitted, you should conduct a fit check to ensure the mask is fitting correctly. Place your hands over the mask, blow sharply. Other PPE, such as safety eyewear, that is used during a daily task should be worn during the fit test. A fit check should be done every time the mask is donned. Okay, once the hood is in place, take nebulizer B, remove both plugs, check the nebulizer is working, and then prior to starting the first exercise, put in the number of squeezes that is required during the fit test. Ask the test subject to breathe through their mouth. Each exercise lasts for a duration of 1 minute. You should apply half the number of required squeezes every 30 seconds. The first exercise is normal breathing. The second exercise is deep breathing. The third exercise is turning your head slowly left and right. The fourth exercise is looking up and looking down. The fifth exercise is talking out loud. Now this can either be talking backwards from 100 or reading the rainbow passage out loud.
99, 98, 97, 96.
Exercise 6 is bending forward. Ask the wearer to hold the front of the hood, bend forward slowly and then back up, and keep doing this slowly. The last exercise is the same as the first, which is normal breathing, nice and relaxed, breathing through your mouth. A fit test should last for a total duration of 7 minutes. A good way to demonstrate the mask has been effective is to break the seal before the hood is removed. Ask the wearer to place their thumb between the chin and the mask and pull it forward and then breathe in. Every fit test needs to be recorded and a template is supplied with the fit test kit. If the wearer detects a taste during the test, it is deemed as a fail but should still be recorded. For further assistance regarding face fit testing, please contact us on 08455 444 000 or drop us an email at sales@betterfit.com.